Hello, friends. Now, when we talk about the antibiotics for use for patient with cirrhosis having GI bleeding, um, the antibiotics does help in these patients. Especially like preventing the rebleeding and mortality rate gets reduced when we use the antibiotics in these patients, because most of the bacteria which causes the infection GI tract are mostly the common gut bacteria, which are generally like gram-negative rods or like streptococcus pneumonia or other streptococci or some enterococci. The antibiotics, which antibiotic should we use? I mean, there's no single agent which has a preference over the other. Um, I mean, quinolones like ciprofloxacin or norfloxacin have been studied, and at the same time, like the cephalosporin, like ceftriaxone, is a good agent in this patient, especially if the patient is showing like some kind of resistance to the fluoroquinolone. And some antibiotic like commonly other than ceftriaxone you could use try the cefepime or the zosyn, which is piperacillin, and tazobactam. Cefepime and zosyn needs renal dose adjustment if these patients are having some renal issues. When you look at the data, supporting the use of antibiotic in this patient, the evidence shows that using the broad spectrum antibiotic like ceftriaxone or ciprofloxacin or norfloxacin, they have reduced the mortality rate by like 79% as compared to just using placebo, or rebleeding risk also gets reduced somewhere around like 53% as compared to placebo. And so it shows the patient with the having cirrhosis with the upper GI bleeding should receive some kind of antibiotic for the spontaneous bacterial peritonitis prophylaxis. Uh, in addition to that, the patient with the if the patient has a previous history of spontaneous bacterial peritonitis, they should also receive some kind of prophylaxis. As well as patients with their who have a low protein level less than 1.5 gram per deciliter, they should also they are the candidate for uh, antibacterial prophylaxis.